There is so much news, so much concern out there about this coronavirus. What can you tell us?
Well, first of all, there's a big difference to SARS, for example, that we have a much more transparent China, and actually the action of China is much more effective in the first days already. We have an international cooperation. We are in daily contact. Our CDC, for example, the Robert Koch Institute in Berlin, the European CDC, the international community is daily checking what's going on. But what I find important is that we put it into a sober perspective. You know, for example, in Germany, up to 20,000 people die because of the flu. So if you put it into that perspective, we take it serious, we are prepared and keep on preparing, but at the same time, I think we have to put it into perspective.
Is there any advice that you're giving the citizens or other citizens of Europe to not travel to China, to take precautions, I mean, what do you do?
Yeah, well, just to realize if there is something like a flu coming, that you feel that there is something, as soon as you realize that and you're coming from China, for example, back to Europe, you should just see a doctor, because our national health systems in Europe and in the US, by the way, in many Western countries, we are able to deal with it. As soon as someone is found with that infection, he will be put into an isolated station in the hospital. We will realize very quickly whom he has met in the past days and to figure out if there is anything we should do. But actually, we know what to do and are prepared, and that is important, I guess. And that is actually an important signal for our people back home too.
Yeah, it's huge and extremely important, really, to reassure. Did you learn anything from SARS? So you have contingency plans in place.
Yes, we learned a lot because of SARS and what we experienced back then. The WHO, the World Health Organization, has actually reformed and developed new institutions of permanent exchange around this, permanent exchange of CDC. For example, during our G20 presidency, Germany has put in place a real, more or less real-time practice for leaders as well. What do we do? How do we engage with each other when something like this is happening? And we really had a kind of emergency room together with all the G20 health ministers. So actually we are really practicing and preparing since SARS, since Ebola, by the way, 5 years ago. We had the same situation. We could just react much too late because of a very intransparent situation, and that has definitely changed.
Will we ever be able to get on top of some of these viruses? I don't know whether it's before they happen or in a couple of weeks after we find out about them. I know you're very focused on innovation in health. What do people don't realize that scientists are working on?
Well, there are many new drugs, for example, drugs that for the first time might heal people with diseases that we even can't treat today. We see that especially for rare diseases. That's a very interesting, very good development. And at the same time, of course, digitalization. It's all over in all areas, and it's something that is ongoing in health, of course, as well. If it comes to online treatment, how do we reach out to patients all over the world, even in developing countries? That was an issue here in Davos too. How can we reach out to people that have not been treated before because we couldn't reach them? And now through mobile devices, we really can reach out and untreat the untreated, and that is something new.
Minister, before you deal with finance, is health, if you look at all the industries, we're disrupting the car sector, we're disrupting finance, is actually health the last industry that really needs disruption?
I'm not sure if it is the last one, but it's for sure one that it needs. For example, in Germany, I would say the health sector is the area where faxes are still used very much as the main communication tool, and that is obviously an issue in 2020. And we are just about to change that, to introduce a digital patient record next year, 2021, really speeding up. You know, regarding URY, for example, I say always the fundamental question is not if we buy from China or elsewhere. The fundamental question is, why are we not able to produce it anymore in Europe ourselves? And the same should not happen with health and digital health. Seeing what is invested in health by Google, Apple, Amazon, and at the same time Alibaba and Tencent in China, we really need to speed up in Europe, and that is what we are doing.
One of the things we've been talking here is, of course, political stability in Europe. People worry about Germany, the the coalition. There are important talks next week with a number of talks on certain points. What do you see as the most difficult points?
Well, what is a challenge for Germany is after 10 years of growth now, there's a risk of taking it for granted. And we obviously need to reform. We need to become more competitive when it comes to corporate taxes, for example. All countries around us are lowering corporate taxes. And we need to take decisions on that, digitalization, to have the right framework, for example, for the use of data. And of course, investment in infrastructure. But for that is important to see for the international community too. It's not a problem of money right now in Germany. We have enough budget for investments, for example, in infrastructure, streets, motorways, whatever. It's a problem of planning processes. We really need to speed them up. That's a European and German issue when it comes to environmental aspects. Of course, they have to be seen, but it should not take 10 years. And that is actually the area of re-regulating.
Chancellor Merkel stepped down from the head of the CDU last year. There was planning to get someone in that place. Are you happy with the process, or does something need to happen to make it different?
Well, it's definitely a new process for us as the CDU in Germany. It's for the first time in our history that we have a chancellor and a chairperson at the same time, and they are not the same person. So obviously that's a time of transition now. That is new for us, and we are still a bit learning how to get on with that. At the one hand, we have Chancellor Merkel, who is internationally actually respected for what she has achieved and is still achieving. For example, Libya just last Sunday. And at the same time, we know as a party, after 15 years of Angela Merkel leading us, now actually we need to plan and shape a future without her. And that is an interesting process.
So what does that mean? Do we need to change that? Is it something that you would consider actually putting yourself forward for?
Well, what it means is that while we are actually still governing, of course, and want to keep on governing in this grand coalition, we have to shape the 20s. And I find it important that our party actually really does the basic debates for the 20s. How do we remain a nation of growth, of prosperity in the next 10 years? How do we keep our society together when we see it is actually polarized and politicized like we've never seen it before in the past years? And how do we develop Germany in the middle of Europe, actually? You know, these Pax Americana, the US is taking care of our security, and we do our business at the same time. That doesn't work anymore, obviously. We need to rearrange that within the transatlantic partnership and within Europe, and that needs good debates.
But is it time for Europe to have its own army? To have its own army?
Well, what we need, of course, is better cooperation within the European Union. We're starting the defense union now, which is an important step, and to have at least common troops that could engage in our neighborhood when necessary. And I mean, we see what's going on in the East, in the Middle East, in North Africa. That's all our neighborhood. And we should not rely on the US to solve problems for us and to just keep stability and peace there. We must be able to do it on our own, and we are not yet there, and for that the defense union is an important project of the European Union.